uncontrolled cell division creates tumor. Still, cancer incidence was not as high as what it is now. So what do you think that changed? Is the lifestyle, refined sugars, ultra-processed food, ultra-processed meat. So these are all the things people tend to consume unknowingly. Just because somebody got the term cancer, we need to be very clear which organ is affected and what stage of cancer is it, rather than thinking cancer itself is a term of, death sentence.
I'm Surya Kiran Enjam, your host for today's episode. I'm going to have an incredible conversation with Dr. Ravikumar Dandamudi. Dr. Dandamudi is a consultant oncologist at Royal Wolverhampton NHS Hospital. Dr. Dandamudi is a clinical tutor, FRCR examiner. He's also a clinical director at New Cross Hospital. He's an organizer for positive connectiveness for last 10 years. He's also raising funds for Cancer Research UK for last few years. Welcome to the Impact Show. Dr. Dandamudi, welcome to the Impact Show.
Thank you.
Thank you for encouraging us. Before we step into lifestyle medicine, I want to ask you, what impact do you want to create?
Okay. So once again, thank you very much for inviting me to the show. Yep. The main impact is basically to get the lifestyle which is essential day-to-day what you do from the time you wake up until you go to bed. So what happens in that kind of time, and what things can be modified, and what kind of lifestyle impact you have on an individual. Mm-hmm. So these are the basic things I want to get people to understand, and also to make them achieve their own goals. Essentially, as you know, health is obviously the first thing everybody want to be. And that's where we start off, from an individual in their own lifestyle, rather than trying to tell them this is what you should do or this is what you shouldn't do. So this is more of creating an awareness, and also promoting the kind of health they want to achieve, and also reversing some conditions. So bringing awareness, and also it's empowering them to lead their own life. So that's the impact I want to create. And being an oncologist with my main background, and knowing lifestyle, which I'm accredited and certified by the British Society of Lifestyle Medicine, and also by the American Society of Lifestyle Medicine. So that enables me to get more evidence-based, the holistic approach that can really help achieving the goals.
Correct. Yeah. Thank you. Speaking on basics, I'm going to deep down very basics.
Yeah.
What is cancer, and how many types are there?
Yeah, so cancer is very generic term, but the first thing people get is obviously cancer is scary. So, and this is another problem, because cancer, majority of them are curable, and some can be managed like any chronic illness. For example, you have diabetes or hypertension. People do have that, but they live their own life. So the other group of cancers have that kind of tendency, so you can still manage it. And there are minority of cancers which are really quite, in terms of terminal, means less than 12 months of survival. So the cancer itself obviously is quite broad. As we know, I deal with solid tumors. The hematologists deal with the blood-related cancers. So the solid tumors, you have majority of them which can be, sporadic, means you don't have any genetic predisposition. So the word cancer obviously is scary, but it is uncontrolled cell division, technically, if you speak. So normally you have checkpoints where, there is a cell that divides, does the job, and then it expires. But in cancer, those checkpoints are suppressed. But our own body has the mechanism, like tumor suppressor genes. We have oncogenes. So the tumor suppressor genes is obviously, as the name suggests, is to suppress any tumor. So uncontrolled cell division creates tumor. And when it tries to invade into surrounding structures, we call it cancer. So that's the difference between benign, which means there is no invasion. But the cancer has a tendency to spread beyond where it started. So that kind of cancers, we have majority of them, as I said, which are just sporadic by chance. But it's nurturing, for example, somebody might have genetic predisposition, means they inherited it.
Hmm.
But until the environment is created, they may not express. So as an oncologist, your job is to recognize those cancers, and then at least you can educate to control it. So coming back to the question, the cancer, obviously, it can be very variable. And there are cancers which can be caused by your lifestyle changes, from genetic mutations. So in general, the cancer itself should not be as scary as people think, because majority of them are curable. And this is where the education is very important.
Sure. Cancer, you were saying inheritatory. Can it be hereditary?
Yes.
Okay.
So it's just like genetic mutations take. So going back to what I was saying, the tumor suppressor gene, for example, the common one people think is the breast cancer related. We call as BRCA genes. So BRCA1 and then BRCA2 genes. So these are actually tumor suppressor genes. But the mutation happens and they are not doing the tumor suppression that leads to cancer. So mainly it's the breast cancer, and there's a minority of ovarian cancers as well. So those are inherited.
Okay.
And if you have a familial predisposition and also some kind of, Ashkenazi Jews, we call it, and they tend to have more BRCA gene mutations. So that usually they have a family history.
Okay.
Yeah.
Thank you for that. Coming to lifestyle, does age and lifestyle choices play crucial role in getting cancer?
Very much. So the somatic mutations, or like most of the cancers, can be sporadic. And that's the area where the lifestyle plays a big role. It's like cumulative effect of how many years you've been spending that kind of lifestyle. Yeah, I mean, the basic principle I use is like, if you go back to maybe a few decades, we didn't have so many medications, we didn't have so much of testing, but still cancer incidence was not as high as what it is now. So what do you think that changed? Is the lifestyle.
Correct.
Why lifestyle? Yes, people were focusing more on industrialization. We had like 2 big wars, and then people want to develop. So industries have to grow, the food production has to grow, and people have to consume it. So the aim of these markets is not to make you healthy. They want their product to sell.
Correct.
And how to sell? It need to be more tasty. It need to be very quick, where you don't need to work on it. But unfortunately, our bodies have not changed so much, because traditionally we've been more of working and to get food, like hunting and all these things. Yes, there's many changes. The evolution has happened, maybe technology, but our bodies still remain the primitive, what kind of digestion you have. So that kind of ready-made, for example, refined sugars, ultra-processed food, ultra-processed meat. So these are all the things people tend to consume unknowingly, because that is what is available. You only buy what is available unless you look for the things you want. And day-to-day struggles, people are least concerned about choosing this. They don't want to spend time. So I started in my own cancer patients. For example, I do mainly breast cancer, prostate cancer, where we do suppress the hormones in those cancers, which are hormone kind of what we call as positive. And that obviously leads to lack of estrogen in women or testosterone in men. And that causes other problems, for example, increased risk of heart-related conditions or stroke. So that's where my focus has been, to change the lifestyle. Yes, you need to treat the cancer, but don't cause any other problems on top of their cancer, like early heart-related problems or any stroke. So the reception will be better because you already got some cancer, and your the kind of changes can be quick to adopt. But I'm talking of the healthy individuals and the lifestyle changes, which we ignore until something hits you. The same like heart, everybody knows, more cholesterol or more sedentary lifestyle. But cancer is also similar. So that's where lifestyle plays a major impact. Yes, there are genetic causes, but majority of cancers are not related to the genetic predisposition.
Okay, interesting.
So lifestyle does play a crucial role.
Okay. From lifestyle perspective, do indigenous people get cancer?
What do you mean by indigenous? Like what type of people you're
Like
looking?
tribal people, or living in Amazon forest, or living in the mountains.
Yeah, they can get, but their lifestyle may be favorable. As I was quoting before, the Ashkenazi Jews,
Correct.
they have more BRCA gene mutations. But again, if their lifestyle is much better, they might get genetic, being the cause of their cancer. But until the epigenetics triggers, sometimes the genetic expression may not happen. You can delay it. So for example, those people you quoted, they might be working hard. They're not sedentary. And their incidence of cancer is actually lower than you look at the general population in the urban or suburban surroundings.
Correct.
Yeah.
And diagnosis-wise, is there any asymptomatic
Yeah.
from your experience?
Yeah, there are quite a few cancers which can be asymptomatic. There are few cancers where you can do screening, even though they are asymptomatic. But you may not have screening and it still can be asymptomatic. But it depends on an individual, because somebody might have symptoms they might ignore. Going back to simple explanation, for example, enlarged prostate will cause more, frequency of urination, for example. But that can happen as people get into their 60s and 70s. But some of them might also have cancer. So being aware of that, there is a prostate cancer risk in men as we get into 60, 65s or so. So just asking for a simple blood test like PSA. They may not have symptoms.
Okay.
But that obviously doesn't mean everybody should have a PSA. We don't have that kind of where we can prove that doing a PSA really impacts on their lifespan or anything. And what we call as the cost-effective or cost-benefit analysis. But asymptomatic cancers can be there. And at least if you present promptly to your doctor, they can be early in terms of their stage of cancer.
Thank you. Coming to treatment, most of us heard about chemotherapy, radiotherapy. Is there any other treatments available for the?
Yeah, I think there is a big revolution in terms of immunotherapy, which is actually the basic concept is your own immune system is triggered to suppress the cancer. So immunotherapy is, again, if you talk broadly, it's similar to systemic anti-cancer therapy, we call it. Chemotherapy is a generic term, but immunotherapy is there. And then some of them can be just what we call as targeted therapy, which is not immuno, but just as a tablet form of treatment. So it is again going back to the basics where the change happened, where the mutation happened, and trying to suppress those which are causing cancer, those kind of, the molecular level things. But also try to encourage your own immune system to fight against the cancer cells. So immunotherapy is another thing. Targeted therapy is another thing. And then chemotherapy, as we all know, there are some hormone treatments we can do, like plenty of other hormones have come up for prostate cancer. And these are the kind of, additional treatments we do have kind of available. And sometimes we use radiation as a targeted therapy as well.
Okay.
And that again is the whole body can be treated where there are some cancer cells that have spread, for example, bones from prostate cancer. So those are the things we can add to the normal treatment on top of like what they usually had initially if the cancer has spread widely. So immunotherapy has really revolutionized, and we started off like mainly melanoma, and that has now into many cancers, for example, lung cancer and also for bladder cancer, breast cancer. So immunotherapy is quite commonly used now.
Okay. Going back to diagnosis.
Yeah.
Is there any screening available called whole body screening that you like kind of checklist everything, including the blood test? Is there anything?
I think let's say quite a lot from there. For example, traditionally the mammogram, for example, for breast cancer has been part of the screening. Again, it depends, some age 47 or even 50 in UK. So that is like, it has proved it will save lives. And the cost effectiveness and cost benefit analysis, if you do, that is much better. And the number treated to reduce or improve the lifespans is good. So mammogram and cervical smears, for example. So those are like commonly used. But the whole body scan as such, we don't recommend because none of the medical associations have, approved doing a whole body MRI scan or a CT scan, ultrasound scan is really needed or it is beneficial. But I know that majority of people are scared. Maybe they have family history. Unless they have a specific gene mutations where the screening starts early. For example, in breast cancer, if there is a family history and BRCA gene positive, yes, definitely screening is there. But that's again not whole body. So the whole body screening, just because of fear of cancer, for example, CT will expose more radiation. And you actually, as you add up, you cause more harm because of radiation. So that's not recommended. And MRI whole body, although there is no radiation there, but again, is not recommended. There will be a lot of false positives or false negatives and unnecessary testing, anxiety, again, not recommended. Ultrasound routinely is not recommended. The blood test, it's not yet commonly done, but what we call circulating tumor DNA, like a simple blood test, lung cancer, it releases some circulating tumor DNA. So a simple blood test can detect if there are any cancer cells. It's also coming for breast cancer, mainly when the cancer has spread to other parts of the body. For two reasons. One is to diagnose when the cancer is not there, for example, in lung cancer, or even to look whether the cancer is responding to your treatment. But that's again in the pipeline, not yet available. But that blood test, or liquid biopsies, we call it, will be something I'm expecting maybe in the next 5 years or 10 years it may take. So routine screening, just generic whole body is not recommended. But there are specific cancers where, for example, in UK, we do mammograms. And definitely, whatever the age they are invited to attend, they should attend. And cervical smears, again, part of it. The PSA, again, not a norm, but they can get tested once they have got any symptoms or after 65 or 70, just as a screening if they want to. But again, whole body, the anxiety it gives, I want to discourage people unnecessarily getting this done.
Sure.
Yeah.
From your experience, that you've been with NHS for a long time, what is the survival rate if someone asks you for a cancer patient?
It's a big question. As I said, different cancers.
Okay.
But majority, more than 2/3, they are curable.
Okay.
So that's the first thing to start off. And just because somebody got the term cancer, we need to be very clear which organ is affected and what stage of cancer is it. And majority of cancers, if they're diagnosed early, there is a definitive treatment, usually surgery, or some cancers even just giving radiotherapy. So cancer survival, if you just change 2/3 is curable, rather than thinking cancer itself is a term of death sentence.
Sure. What is messenger RNA? Is a treatment available for everyone?
It's not yet a treatment. It's still in the trial phase. For example, Imperial College London is doing messenger RNA as a 4359. It's like a trial mainly to look for example, in melanoma, they're trying to test. So it is looking for immunotherapy or immunological response, and also looking at how much is the safe dose or what's the tolerability. So it's very early. It's more of a messenger RNA like immunotherapy, but as I said, it's not like a treatment yet.
You specialize in breast and urology, cancer related. Why did you choose these two? Is there any particular reason?
Not as particular, but essentially we tend to pick up two major sites in UK. For example, in India, people practice everything like oncology. So whatever comes with cancer in front of you, so you just treat it. But we tend to specialize here because cancer is ever evolving and a lot of things to get updated. Honestly, you can't get all the cancers as kind of, the standard you need updated. So in UK, as I said, you need to pick up two major sites. And I worked mainly in my training back home in India. in breast cancers and also prostate, bladder cancers. Unfortunately, that's the kind of sites I have to choose. And also that's where I can make an impact in terms of lifestyle, which is always curious for me because, as I said, it's not like, everybody had the statistics, if you look at the same number of cancer deaths as we go back. Yes, people who with cancer might have died, but the incidence of cancer itself was not as high if you go back to some decades ago.
Sure.
So that's where I got interested in lifestyle. And also, as I knew that, not all cancers are related to genetic or, family risk, then there should be something else. And that impact I can create in common cancers like breast cancer or even prostate cancer. And even in bowel cancer, your lifestyle changes can really reduce the incidence of cancer. So I just, chose those two sides. And because my previous training has been more in those two. And also that's where I wanted to create outside the medical treatment, something to, promote health education and reduce the incidence. So yeah, breast and prostate is my majority. Of course, I treat bladder as well. And that's where immunotherapy is used quite commonly now. Yeah.
If our listeners want to know about lifestyle medicine, what are the step-by-step process they can follow, or where do they find the information?
Yeah, so lifestyle, as I said, British Society of Lifestyle Medicine, American if you're here. But if they want to follow lifestyle itself, just that kind of knowing what it involves. So we normally call as 6 pillars of lifestyle. So everything starts with your nutrition. Then we have the exercise. And it's not saying exercise, it's the prescription of exercise and knowing what exercise is really needed to get the benefits. And then obviously you need to look at your sleep pattern. And that's the important thing. Stress management, mindfulness, and any substance use like smoking or any excess alcohol or any drug, recreational things. And social connectiveness is also very important.
All right.
And last but not the least is some inclination towards spirituality. If somebody is an atheist, that's fine, but at least you believe in something, follow it.
Okay.
That's managing 6 pillars is very crucial,
Sure.
not just for cancer, it's in general well-being.
Correct.
So if I go back like last 10 years, that's what I've been promoting and doing myself. So, for example, nutrition, as I said earlier, is the more processed food that we all consume. So we have so many diets that have come up. Keto diet, Atkins diet. There's something like a boom each time you get. And people always want something new, but they forget what is available in the kitchen. They always look outside. So it is just taking them back to the basics. Go back to your organic thing. Any kind of food that is normally available or used to be available in your grandmother's kitchen is what is good. Simply speaking, no processed food, no ready-made stuff. You might be busy, change it the way you are eating. So you still need your carbohydrates, consume whole grains or simple carbohydrates which are not processed. You still need your proteins, just cut down some red meat because that has more inflammation that is being caused. Go back to your normal, like chicken is fine, fish is fine. And the fat, saturated fat, at least reduce less than 10%. So it is simple tweaking of what you're eating and making you aware, for example, those processed meat or sausages that people want to. And this starts from basic, your own day-to-day. And once you start doing it, your children will follow because what you don't cook, they won't eat anyway. So that's where we are taking them back as a family. And that I started with my own patients first. And initially, I thought maybe they will just say yes and then they do nothing. But I needed evidence. And this lifestyle medicine is with evidence base. And then my own patients, I follow them through. For example, I start with simple thing like cholesterol checks or anything. And of any statins, when they follow lifestyle, 3 months I tend to give them. And then they come back to me like, reduced cholesterol levels, your blood pressure has been different, your sleep is different. But basically, I'm dealing with somebody who already got, cancer is there. So that's always there in the background. And modifying their lifestyle is not easy because there's element of depression. And these are the things, the second pillar, exercise. So the exercise again is not saying very generic. So I tend to prescribe exercise. So we always say 150 minutes of moderate intensity exercise in a week. So you can choose minimum is 10 minutes or you can go up to 30 minutes if you want. If you want to do severe, then 60 minutes is good enough. So I'm sure everybody will have that 150 minutes in an entire week where you can contribute towards your moderate intensity. So for example, I have a mom who just has no time, but then she picks up her kids from school and I just ask her, can you just tell me how do you do that? Oh, it's like 5-minute drive. Why can't you walk? You have time? Yes. She said, yes, I'm off in that particular time. So she started doing brisk walking and it only takes 15 minutes, but that goes into her 150 minutes.
Correct.
So simple things like taking stairs, for example, 2 or 3 flights of stairs. So that will add up another 7-8 minutes.
Correct.
So this kind of awareness that they don't need to do big things like joining a gym and not going there, paying membership, all that common stories you hear. So that is part of your cardio is 150 minutes moderate intensity in a week. And then you alternate with resistance training. Like some people tend to do weights. Again, you don't need to do heavy weights. It's knowing what you are targeting. So you want the musculoskeletal, that kind of strength training. And that also improves your general stability. Because as people get into 60s, 70s, the balance is important. So that adds to their strength. So same thing with the day-to-day things, lower limbs. We just ask them to do squats or semi-squats. And then the third phenomenon, like we ask them, is to do flexibility. Because you don't want to be stiff. That affects your day-to-day, like joint aches and pains. Yoga has been pretty good in that. Tai Chi, some people chose. And it's a shame that the majority of our Indians who always, been taught yoga is good, very, very few really follow it. And doing these kind of three, like, the cardio, strength training, and flexibility with some mindfulness, just being in the present. That is where I connect them back to, for example, of Indian origin. Then I tell them what we have been doing. Like some people used to say, focus on your breathing, or some just say, live in the present. Or some say, this is the mantra, you just chant. All that is actually nothing but you're focusing on that present, the mindfulness. You don't need to be spiritual to do this, but that's where the anxieties and all calm down. And your own physiology will take action. So this is kind of simple things, but that makes a major impact. And in terms of sleep hygiene, as we know, we all are addicted to our mobiles or blue light. And these are the things we just tell them. This is usually 10 to 11-ish at night. That's when the melatonin is being released. But you're keeping your, what we call, reticular activating system in the brain. Basically, you're being active because you're watching something. Your brain thinks, oh, you need to be awake. So that melatonin is never released. So your quality of sleep is not going to be the same. It affects your fatigue, your immune system. So these are all interlinked. And the cancer patients, once they know this is like they already had a big hit, they tend to be more committed. But now I want to take them to the normal, public. Quoting examples of those with cancer. For example, in prostate cancer, not every prostate cancer needs treatment straight away. So we have something called surveillance. So actively we monitor. And those are the right patients we tend to choose to delay the progression when they need treatment. And the evidence is there. For example, they've taken biopsies when they were diagnosed with cancer. It could be early cancer. So no treatment, followed lifestyle, and another cohort or group of patients followed no kind of lifestyle. They can do what they want. They have redone the biopsies. And rather than progression, there is some regression of the cancer cells. So we do have some evidence there, but I'm sure there will be more evidence.
Sure.
And these are the things, the impact lifestyle can create.
Out of the lifestyle medicine, these 6 pillars, nutrition is the first and foremost.
Yeah.
Okay. Right. Interesting.
Yeah, because that's where you can at least control or say, I don't want to eat this.
Yes.
But commonly ignored.
Correct.
Yeah.
Thank you for sharing your knowledge and skills, insights. How can people reach you if they want to look at your work or what you do? And then
Yeah, I mean, I don't have any website or anything, but normally I'm available. Usually I tend to prefer email, which
Sure.
I'm happy to share, or even contact number for some who want to really discuss further.
Okay.
And that's where I think the real change can happen.
Sure. Thank you. We will drop email ID or email ID
Yeah.
in our link. And thank you so much, Dr.
Thank you very much. All the best.
Thank you very much. I learned a lot. What about you? Please comment in the section, subscribe, and share with your loved ones. We'll see you in the next episode. Until then, ciao.